To start with, I would like to welcome our distinct guest from Sudan. And that is the hospital I work, Lieutenant General Hospital. And I think it will be a very bad idea if you're going home without visiting Donegal, as you can see from that background. And to let you know, more than 50% of the medical doctors and surgical doctors in that hospital are Sudanese. So that will be another reason to come and visit us there. And at the same time, I would like to thank our colleague from Ireland, leaving all the attraction outside and staying with us late. So the first question is, I'm going to talk about two initiatives for supporting renal service in Sudan. And I think the first question will be, why renal? The straightforward answer, because I'm a nephrologist. But I think more important, acute kidney failure, acute kidney injury, or renal disease is on the top 10 of the killing disease from hospital in Sudan, and that's from the Federal Minister of Health report 2010. Globally, we have seen an expansion in patients with kidney failure and needing dialysis. We start this century, we start this decade with more than 2.5 million on dialysis. And as we know, dialysis is a very expensive service. That's why we are spending more money globally to deal with those patients. And worldwide, we're expecting to spend more than 1.1 trillion for the coming decade to deal with those patients. And that expansion of patients with kidney failure or end-stage kidney disease needing dialysis is not local. It is a global phenomenon from Far East, Taiwan, to far west in Mexico. That rising tide of patients needing dialysis has been driven by diabetes and hypertension, and I'm glad to hear those initiatives for diabetes support for our beloved country, Sudan. In Ireland, we are not an exception. This year, we started to have more than 3,000 patients with end-stage kidney disease needing hemodialysis in Ireland. And if you look globally, from this data from United States, 11% of Americans they do have some degree of chronic kidney disease, either mild or chronic or severe. And I would like you to see patients with severe kidney failure that need dialysis are only 0.2% from those 20 million. That's to say, what we are seeing is just the tip of the iceberg from kidney disease. And I think that's a very important concept for policymakers in managing health services in Sudan. If you have a complete kidney failure, you have three options: hemodialysis, peritoneal dialysis, and kidney transplantation, or if you are unlucky, you will die. Kidney transplantation is superior because patients live longer, but also because it's less expensive options. I tried to get some figure or data from Africa. This is the best I could get, and I would like to thank Professor Hassan Abasha, who gave me those data. In South Africa, we're talking about 100 to 200 per million population patient with end-stage renal disease. In South Africa, the figure is 200 to 300. And Sudan in the Middle Africa is something in between. It's around 150 per million populations. 2/3 of those patients are on hemodialysis. And when I saw these important slides, I was surprised because Sudan is only second to South Africa in terms of number of patients on dialysis, both hemodialysis and peritoneal dialysis. And as you can see, many of those unfortunate countries, they don't have even dialysis facilities. So I was surprised, and I was very proud with that figure, because with all our stresses, financial, war, sanction, and everything, we are still second only South Africa in sub-Saharan Africa delivering this expensive service. But I was less surprised when I read the history of nephrology in Sudan. And Sudan is one of the first in Africa and Middle East to have peritoneal dialysis and hemodialysis back in 1969 and 1971 for hemodialysis. Then I think the main milestone in nephrology service in Sudan was in 2005, where the government, from the high top of the government, they do commit themselves for a free charge dialysis service in Sudan. I think that's the most eminent lifestyle in life, the main figure or the main factor in the milestone in nephrology service in Sudan. I took this figure from the National Kidney Center. We have around 450 patient on maintenance hemodialysis in Sudan. I think that number again is underestimating, because from the first figure I show you, in Ireland we have 3,000 for 4 million population. In Sudan we have 4,000 for 40 million population, so that's still very underestimated. So the first initiative to support renal service in Sudan was an educational one. This is the number of nephrologists. Up to 2006, we had only 19 nephrologists in Sudan, maybe a little bit more. But again, the number, we do have nephrologists here in Ireland for 4 million population, far more than that number. So at the same time, we do have many other doctors working in the nephrology field without training, and they do offer a great service on the ground there. So the first initiative was, can we do anything to support or to help those doctors in delivering their renal service back in Sudan? So we did a nephrology update course. It was a very extensive 3-day course. As a group, we went here, 2 nephrologists from Ireland and 2 from UK, and we timed that with the last Sudanese Physician Association annual meeting back in February. And this initiative came in the context of a group called Salamat, that is Sudanese and London Association Medical Aid Trust based in UK, but they do have members in Ireland, where they have an annual convey to support various medical and social activities in Sudan. So we targeted the renal fellowship, those on renal fellowship program in Sudan. And together with those, especially outside the capital Khartoum, running the dialysis service. And we did support it by the National Center for Kidney Disease in Sudan, and we did have an excellent participation from local experts headed by Professor Hassan Abu Asha, Professor Kaballu, and another colleague. And the program was very extensive, starting 8 o'clock in the morning to 8 o'clock in the evening, and there was an excellent turnout for the program. We had an excellent feedback, and more important, we did establish a network, and I do get on a weekly basis an email from someone in Kosti or in Sinnar asking about specific clinical questions that need to be answered. And more important, this event is going to be annually, and the second course is going to be February 2003. The second initiative was the Service 1. I took this from the National Kidney Office from Dr. Muhammad Al-Sabiq, who is the director of the program there. And as you can see, the government paid around 150 to 200 Sudanese pounds for each dialysis sessions. And again, that is huge money for a country in developing world. And so obviously that money mostly is delivered to get the service, to get this patient alive and not dead. And obviously they didn't need any fund to have their machines maintained on annual basis. So all the fund went for the service and nothing for annual maintenance and rehabilitations. And I wasn't surprised when in the major head newspaper, every couple of weeks or even months, something big, something in one of the big paper about nephrology. Like I took those headings in the last couple of months: state of crisis in Adbara dialysis unit, lack of dialysis machine, state of crisis in administration at Jazeera because of lack of machines and supplies, severe shortage of dialysis machines in major Khartoum renal units. So there's a need for dialysis machines. So I was thinking, how can we support this part from here? And luckily enough, in Ireland, last year we had what is called the National Renal Tender Program in Ireland, and a part of that, all the units, they do have their dialysis machine upgraded, and those machines are functioning in excellent conditions. So I sent a letter to the Muhammad Al-Sabiq, the director of the National Kidney Center in Sudan, and I told him I have 40 machines in my unit to support dialysis unit in Sudan. Initially, I know there are some restrictions to get second machine from outside, but I sent this letter to see these machines are excellent, they are infection-free, and they're going to function for the coming 10 years without problems. So I would like to thank people in Letterkenny. I had 23 dialysis machines from them. 43 dialysis machines from Talamur and Kaban Hospital. These machines are already delivered and start functioning in Khartoum and around Khartoum. And then I had 17 machines from Sligo, and these machines are not, they are not a second-hand car. They are functioning in my unit up to last week. Because we are committed with a new company to get another tender, that's why we give up using those machines. So basically, we start collection transportation. So a total of 80 dialysis machines has been collected with this initiative. 40 of them, as I said, are already functioning there, 40 on the way to Sudan. When I spoke to Dr. Mohammed Sabiq in Khartoum about the shipping cost and delivery cost, although it was minimum, but still it was very difficult to get any $1 from the government in Sudan. So it took a lot of time, paper going and in and out here and there. I started to get frustrated. And I mentioned that to a group of friends in my hospital, and then from that sessions, they start donations, and we had now the first dialysis machine, that's the 40 machine, has been paid by Sudan, but the second 40 machine is already collected and is going to be charge free for Sudan. So what did this initiative mean? Well, in terms of service, if you have one machine is going to work 3 times a week, so that means you are going to serve 830 dialysis patients from Sudan in the coming 10 years, annually. In terms of money, I did a quick search of what's the price of those machines, and the average price of that machine is $607.50 US. So for the 80 machine, it is $500,000 for Sudan. On behalf of every single dialysis patient and every single worker in renal service in Sudan, I would like to thank Midland Regional Hospital, Talamur, Letterkenny General Hospital, Cavan General Hospital, University College Hospital, Galway, the Sligo General Hospital for their generous donations. And I think when they know those machines are going to serve and put a smile on the face of those kids, they're going to be very happy, very proud with that initiative. And I think when we knew there are people there very keen, well motivated, they're trying to do our best with the limited resources, I think we can do more. And I think there are many potentials there for initiative. Just we need to all work together. Thank you very much.